Anatomy DAHAR series, Paranasal Sinuses, Basic for Undergraduates, 2020, Diagram-based program, free education, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Introduction to paranasal sinuses. Para in Greek means beside or adjacent to. Nasal in Latin means pertaining to the nose. Sinus in Latin means cavity or space. Therefore, paranasal sinuses are air-containing cavities in the bones around the nose. Commonly, there are 4 sinuses on each side of the head: sphenoidal sinus, ethmoidal sinus, frontal sinus, and maxillary sinus. Each sinus is usually confined to a bone and named accordingly. However, they often extend to the adjacent bones. The nasal cavity and paranasal sinuses increase the surface area of the upper part of the respiratory tract. They are lined by ciliated mucosal membrane, where mucus is secreted by the goblet cells. Vascular plexus lies deep to the membrane. Paranasal sinuses are complex and consist of extremely narrow spaces and clefts with many nooks and corners. Introduction continue. Paranasal sinuses have a wide range of anatomic variations, both between different people and between the two sides of the same individual. The sinuses are very commonly unequal in size and shape. More importantly, the relations around them vary due to abnormal widening and extensions of the sinuses. Therefore, it is crucial for the surgeons to be aware of the anatomic variations and related structures of the sinuses to ensure the efficacy, safe, and optimal benefit for the patient in sinus surgery. Due to the vast complexity and wide anatomic variance of the walls of the nose and paranasal sinuses, the author has tried his best to present the most accepted facts obtained from numerous resources available. Original schematic illustrations are drawn by the author himself for anatomical accuracy and accompany the relevant text for easy understanding. As the saying goes, a picture is worth 1,000 words. Next slide, please. Skeleton of the nose and paranasal sinuses. The skeleton of the nose and paranasal sinuses are osteocartilaginous framework. That means they are made up of bones and cartilages. In this diagram, we are showing only the bones. The first bone is butterfly-shaped, called sphenoid bone. It is located at the central part of the base of the skull. Sphenoid bone consists of body. Above the body, there is a pair of small wings called lesser wing of the sphenoid. Behind each lesser wing is bigger wing called greater wing of sphenoids. And above the body is a shallow area where pituitary gland is located. We call pituitary fossa. Below the body on each side is a pair of flat bones are there called medial and lateral pterygoid plates. The body consists of sphenoidal air sinus. This is the second bone called palatine bone. It has 2 parts. This is perpendicular plate of the palatine bone and this is horizontal plate of the palatine bone. The third bone is ethmoid bone. It is also centrally located bones at the base of the skull, just anterior to the sphenoid bone. Both sphenoid and ethmoid bones are single bones. This is flat triangular bone called cristacellae. On either side of cristacellae is perforated plates called cribriform plates. Below the cristacellae is the perpendicular plate of the ethmoid bone. Then on the lateral side of the ethmoid bone is lateral mass of the ethmoid bone. This lateral mass consists of ethmoidal air sinuses. Next is maxillary bone, huge bone. This is the body of the maxilla. This process is called frontal process of the maxilla because it will articulate with the another bones up there, the frontal bone. That's why it is called frontal process of the maxillary bones. Inside the body of the maxilla is maxillary air sinus. The fifth bone is the lacrimal bone. It's a very small flat bone in front of the ethmoid bone. And in front of the frontal process of the maxilla is another bone, that is the nasal bone. Parts of the ethmoid bone. Ethmoid bone is centrally located bones in the skull, and it is related to many important structures. This is cristacellae, a thick triangular process at the anterior part and middle of the ethmoid bone. On each side of the cristacellae is cribriform plate. That means perforated plates with so many foramina are there. Above this plate is anterior cranial fossa. Through this foramina, the olfactory neurons enter from the olfactory area of the nasal cavity and come into the anterior cranial fossa and reach to the olfactory bulb, which is the first cranial nerve. This is frontonasal duct, the duct coming from the frontal sinus enter into the nasal cavity. This is lateral mass of the ethmoid bone. This is lateral mass of the ethmoid bone lying between the orbital cavity on its lateral side and nasal cavity on its medial side. It consists of clusters of honeycomb air cells, the ethmoidal sinuses, also known as ethmoidal labyrinth. Labyrinth means a system of intercommunicating cavities. This is downwards continuation of cristacellae called perpendicular plate of the ethmoid bones. This will form the upper part of the nasal septum. We'll discuss this one later. This is turbinate, also called concha. Below the turbinate is meatus. This area, this nook is called sphenoethmoidal recess, very important, which forms the roof of the nasal cavity, and then olfactory area is located here. We will discuss this one later. In these slides, we have two diagrams. This one is showing the bones around the nasal cavity. Bones on the right side, bones on the left side, above and below the nasal cavity. This is the anterior nasal opening or anterior nasal aperture. The structures forming the boundaries of this anterior nasal apertures are above two nasal bones superiorly, on each side frontal process of the maxilla, below body of two maxillary bones. Okay, then next one is we are showing the inner surface of the nasal cavity, that is inner surface of the lateral wall and upper surface of the floor of the nasal cavity. You know these bones from anterior to posterior nasal bone, frontal process of the maxilla, lacrimal bone, ethmoid bone, perpendicular plate of the palatine bone and medial pterygoid plate. Here we have two big openings are there. This opening is between the ethmoid bone and maxillary bone. We discussed this bone in another place, that is on the lateral wall. And here is one small bone between the medial pterygoid plate of the sphenoid and palatine bone. This is sphenopalatine foramen is there. That is the entrance into the nasal cavity. The floor is formed by two bones. Anterior 3/4 is formed by palatine plate of the maxillary bone. Anterior 3/4, palatine plate of the maxillary bone. Posterior 1/4 is formed by the horizontal plate of the palatine bone. Two together form the hard palate. Structures of the lateral nasal wall. Lateral nasal wall consists of so many structures are there. First group is bones involved. From anterior to posterior are, this is nasal bone, frontal process of the maxilla, lacrimal bone, ethmoid bone, perpendicular plate of the palatine bone, and medial pterygoid plate. This is ethmoid bone and this is maxillary bone. Between these two, there is a shallow gap is there, which is partially closed by thin plate of bones called uncinate process, which leaves shallow semilunar shaped gap here called hiatus semilunaris. This is medial surface of the ethmoid bone. At the lower part of the medial surface of the ethmoid bone, we have a bony prominence is there called ethmoidal bulla, which is above the hiatus semilunaris. Ethmoidal bulla may be solid or contains cluster of air cells. Nasal conchae or turbinate. Actually, we have already presented this topic in the nose file. What are the nasal conchae or turbinate? Nasal conchae or turbinate are shelf-like curved bony projections on the internal surface of the lateral nasal wall. They are three in number: superior, middle, and inferior. Superior turbinate is the smallest, high up there. It is about 7 to 27 mm long. The middle one is about 30 to 54 mm long. Then inferior one is the longest, about 35 to 58 mm long. Superior and middles are attached to the medial surface of the ethmoid bone. The inferior turbinate is the largest and is a separate bone made up of bones and erectile tissue. It is a separate bone. Recess and meatuses. We are showing the diagrams of inner surface of right lateral nasal wall. What are the recess and meatuses? They are areas or passages on the internal surface of the lateral nasal wall. They are related to the turbinate. Let's see few structures on this wall now. Very high up here is cribriform plate of the ethmoid bone. This is superior turbinate. This is middle turbinate, and this is inferior turbinate. Now we are going to talk about the passages or spaces related to the turbinate. Above the superior turbinate, that is between the cribriform plate and superior turbinate is a passage there in front of the sphenoid bone called sphenoethmoidal recess. So sphenoethmoidal recess is above the superior turbinate, below the cribriform plate. Next, we are going to talk about the meatuses. Superior meatus. Superior meatus is underneath the superior turbinate. This is superior meatus. Then middle meatus. Middle meatus is under the middle turbinate. This is middle meatus. Then inferior meatus, which is under the inferior turbinate. This is inferior meatus. The paranasal sinuses, general locations. This is anterior view of the skull. This is left lateral view of the skull. Paranasal sinuses are air-containing cavities in the bones around the nose. There are 4 in number on each side of the skull. This is frontal sinus in the frontal bone. This is sphenoidal sinus in the body of the sphenoid bones. This is ethmoidal sinuses. They are also in the lateral mass of the ethmoid bone. This is maxillary sinus. They are in the body of the maxillary bones. Anterior view of the skull. This is frontal bone. This is zygomatic bone. This is maxillary bones. And this is the mandible. This is orbital cavities. This is nasal cavity. If you see, here is 2 nasal bones above the nasal cavity. It is articulated to the frontal bone, and the junction here is called nasation at the center between the nasal and frontal bone. This is left orbital cavity. Above here, there is a ridge called superciliary ridge. And here, this is the orbital margins of the right orbit. This margin is called supraorbital margin. Supraorbital margin. Frontal sinuses. Location and vertical extent. A pair of frontal sinuses are located in the frontal bone. Each is above and deep to the medial part of supraorbital margin. This area is the medial part of the supraorbital margin. So frontal sinuses are above this supraorbital margin. It is irregular pyramidal in shape. The frontal sinuses are often asymmetric. The septum between the 2 sinuses is seldom in the middle, occasionally incomplete or deficient. The vertical extent varies from 24.3 mm to 66 mm. The duct of the frontal sinus, frontonasal duct, commonly opens into the ethmoidal infundibulum in middle meatus. Sizes of the frontal sinuses. Superior view of anterior cranial fossa. This is crista calli, and on each side is cribriform plate of the ethmoid bone. Anteriorly is foramen cecum, small foramen here, through which in 1% of the case veins from the nasal cavity will come out from here and join with the superior sagittal sinus. This is orbital plate of the frontal bone. Here is optic chiasma, optic nerve, and we have a pair of frontal sinuses. This is a horizontal section in the outer and inner tubule of the frontal bone. Ethmoidal sinuses. Ethmoidal air sinuses are clusters of thin-walled, honeycombed air cells in the lateral masses of the ethmoid bone. They are also known as labyrinth, a system of intercommunicating cavities. They are arranged in three main groups: anterior, middle, and posterior group of air cells separated by septa. This is anterior group, this is middle group, and this is posterior group inside the lateral mass of the ethmoid bone. Anterior group consists of about 11 air cells. Middle group consists of about 1 to 3 air cells, and posterior group consists about 1 to 7 air cells. This is the anterior view of the skull. We are going to discuss about the maxillary sinuses. This is zygomatic bone. This is maxillary bone. This is zygomatic process of the maxilla. This part is the body of the maxilla. Maxillary sinuses were first reported in 1651 by Nathaniel Haimo, and thus it is also known as antrum of Haimo. It is the largest of the paranasal sinuses, occupies the body of the maxilla. Its shape is a four-sided pyramidal shape, consists of a base, an apex, and four walls. Base, apex, and four wall. Maxillary sinus continuation is the enlarged maxillary sinus. Look here at the picture. In the picture, this is the base of the maxillary sinus. This is the apex of the maxillary sinus. Base of the maxillary sinus is directed medially towards the lateral wall of the nose, and its apex is directed laterally into the zygomatic process of the maxilla. Base is directed medially towards the lateral wall of the nose, and apex is directed laterally towards the zygomatic bone. It is often enlarged and the apex extends laterally into the zygomatic bone. You can see in this picture. Walls of the maxillary sinus. The maxillary sinus is a four-sided pyramidal-shaped cavity which consists of a base, an apex, and four walls. Very first one is the base. Red color number 1. You look here in this diagram. The base of the maxillary sinus is, this is the base of the maxillary sinus, which is related to the lateral wall of the nose. Second is the apex. This is the apex of the maxillary sinus, directed towards the zygomatic bones. Sometimes it extends into the zygomatic bone. Next, number 3 is the superior wall or roof of the maxillary sinus. It is also forming the floor of the orbital cavity. Through this, we have infraorbital nerve and infraorbital vessel traverse through this wall. Next, number 4, inferior wall or floor of the maxillary sinus. They are also alveolar part of the maxilla. It is about 1 to 1.25 centimeter lower than the floor of the nasal cavity. It is closely related to the roots of the upper molar and premolar teeth. Next is number 5, that is anterior wall. Look at this triangle. This is related to the cheek. And number 6 is the posterior wall. Number 6, this tiny little triangle facing backwards towards the infratemporal fossa and pterygopalatine fossa. Maxillary sinus has a capacity of approximately 15 ml in adults. The ostium, the opening of the maxillary sinus, is high up in its base. We will show you in the next slide. Structures related to the base of the maxillary sinus. The maxillary ostium is at the upper part of the base. You can see here. It commonly, that is in about 68%, opens into the hiatus semilunaris of the middle meatus. Nasolacrimal duct, this is the one, is deep to the base of the maxillary sinus. Distance of the maxillary ostium from the roof is about 1.3 mm. From the nasolacrimal duct is about 4.5 mm. Floor of the maxillary sinus. Its relations to the roots of the teeth. The floor of the maxillary sinus is the alveolar part of the maxilla. It is about 1 to 1.25 cm lower than the floor of the nasal cavity. This is the floor of the maxillary sinus, and this is the floor of the nasal cavity. Floor of the maxillary sinus is about 1 to 1.25 cm lower than the floor of the nasal cavity. So floor of the sinus is closely related to the roots of the upper molar and premolar teeth. Therefore, infection can spread from carious teeth. The floor is often perforated by roots of the teeth. Extraction of these teeth can cause oroantral fistula. Nerves related to the maxillary sinus. The maxillary sinus is related to the anterior, middle, and posterior branches of the superior alveolar nerves, which is a branch of the maxillary nerve, V2, the second division of the trigeminal nerve. Clinical correlation of the maxillary sinuses. Maxillary sinuses are the largest paranasal sinuses, and they are most commonly infected, called sinusitis. It is due to many factors. Maxillary sinuses are located at the lowest level, inferior to the other sinuses, and even its floor is much lower than that of the nasal cavity. Therefore, the drainage from the other sinuses and from the nasal cavity very often flows into it. It acts as a secondary reservoir for the mucus from other places, which could be infected mucus and pus. Its floor is extremely thin, which forms the roof of the mouth. Therefore, infection can spread to the maxillary sinuses from below through the roots of the carious upper molar and premolar teeth. It is also common in cases of oroantrum fistula, that is abnormal communication between the oral cavity and the maxillary sinus after tooth extraction. Furthermore, the opening, that is ostium of the maxillary sinus, is located high up on its basal surface, related to the lateral wall of the nose, and the opening is very close to the roof. Thus, it is very unlikely to have drainage by gravity as in other sinuses. Infected mucus is thus collected and leads to sinusitis of the maxillary sinus. Sphenoidal sinuses. Size of sinus and positions of the ostium. Mid-sagittal section. This is the body of the sphenoid bone. This is sella turcica, Turkish saddle, the pituitary gland, and this is the optic nerve. The sphenoidal sinuses are a pair of sinuses located in the body of the sphenoid bone. Very often asymmetric, the septum is seldom in the middle, occasionally incomplete or deficient. Thus, the size of the sphenoidal sinuses varies from small to very large. Relations of the sphenoidal sinuses. The diagram is the mid-sagittal section of the sphenoidal sinus. Sphenoidal sinus is related to many structures. Superior and anteriorly, olfactory tract, optic chiasma, frontal lobe in the anterior cranial fossa. Superior and posteriorly, pituitary gland in sella turcica. Laterally, cavernous sinus with the internal carotid artery, cranial nerves 3rd, 4th, 6th, and 1st and 2nd divisions of the trigeminal cranial nerves. We'll see in next slide. Posteriorly, middle cranial fossa, basilar artery and the brainstem. Inferiorly, nasopharynx, pharyngeal lymph nodes, and anteriorly nasal cavity. Sphenoidal sinus in relation to the cavernous sinus. This is a pair of sphenoidal sinus in the body of the sphenoid bone. Above is the pituitary gland. Lateral to the pituitary and sphenoidal sinus is the cavernous sinus, number 1. Inside the cavernous sinus, we have an internal carotid artery and 6 cranial nerves. Number 2, on the lateral wall of the cavernous sinus, you can see here oculomotor nerve, that is the 3rd cranial nerve, trochlear nerve, 4th cranial nerve, and then below is ophthalmic, V1, and maxillary, V2 divisions of the trigeminal nerve. The 6th cranial nerve is inside together with the internal carotid artery. Infralateral to the sphenoidal sinus is the pterygoid canal with the nerve of pterygoid canal, also known as Vedian nerve. Ostia, that is opening of paranasal sinuses on the right lateral nasal wall. Ostia, openings of sphenoidal sinus, frontal sinus, posterior, middle, and anterior ethmoidal sinuses, and maxillary sinus. Before we talk about the ostia, shall we see the structures on the lateral wall of the nasal cavity? This is cruciform plate. This is superior turbinate. This is middle turbinate. And this is inferior turbinate. The space or passage between the cribriform plate and superior turbinate is sphenoethmoidal recess in front of the body of the sphenoid. The passage under the superior turbinate is superior meatus. The passage under the middle turbinate is middle meatus. The passage under the inferior turbinate is inferior meatus. Now let's talk about the ostia. The first one is sphenoidal ostium, that is the opening of the sphenoidal sinus. It opens into the sphenoethmoidal recess. This is the opening of the sphenoidal sinus. It opens into the sphenoethmoidal recess, which is between the cribriform plate and superior turbinate. Next is posterior ethmoidal ostium, that is opening from the posterior ethmoidal air cells. It will opens into the superior meatus. This is the opening of posterior ethmoidal sinus. Next is frontal ostium. This is the frontal sinus. From there, frontonasal duct is coming down, and then it's open into the infundibulum, which will open to the anterior part of hiatus semilunaris. So your frontal ostium is here at the anterior end of the hiatus semilunaris. Next is middle ethmoidal ostium. It opens on the bulla or upper part of the bulla in the middle meatus. Next is anterior ethmoidal ostium. It opens to the anterior half of the hiatus semilunaris in the middle meatus. Next is maxillary ostium. It opens into the posterior half of the hiatus semilunaris of the middle meatus. This is the opening of the maxillary ostium. And finally, in the inferior meatus, we have the opening, but it is not from the sinus, but it comes from the nasolacrimal duct, opening of the nasolacrimal duct at your inferior meatus. It is about anterior junction between anterior 1/3 and posterior 2/3 junctions located there. Clinical division of paranasal sinuses. Clinically, paranasal sinuses are divided into two groups, anterior and posterior groups. Anterior group consists of frontal sinus, anterior and middle ethmoidal sinus, anterior and middle ethmoidal sinuses, and maxillary sinus. They all drained into the middle meatus. Posterior group consists of posterior ethmoidal sinus, this is the one, which drains into the superior meatus, and sphenoidal sinus, this is the one, which drains into the sphenoethmoidal recess. See figure direction of the mucus transport here. The goblet cells of mucous membrane of the sinuses produce film of mucus. It is moved by the cilia in the spiral motions towards the ostia. Cilia near the ostia are more active. Arterial supply of the paranasal sinuses. Frontal and ethmoidal sinuses received arterial supply from the internal carotid system. Maxillary and sphenoidal sinuses received arterial supply from the external carotid system. A. Frontal sinuses are supplied by anterior ethmoidal artery, supraorbital artery, and supratrochlear arteries. They are from ophthalmic artery, a branch of internal carotid artery. B. Ethmoidal cells are supplied by anterior ethmoidal artery and posterior ethmoidal artery. From ophthalmic artery, a branch of internal carotid artery. C. Maxillary sinuses are supplied by sphenopalatine artery, infraorbital artery, and alveolar arteries from the maxillary artery, a branch of external carotid artery. The sphenoidal sinuses are supplied by sphenopalatine artery, pharyngeal artery from maxillary artery, a branch of external carotid artery. Branches of external and internal carotid arteries anastomose in the nasal cavity and paranasal sinuses, one of the sites where two systems anastomose. Venous drainage, nerve supply, and lymphatic drainage of the paranasal sinuses. These are the names of the paranasal sinuses. This is venous drainage column. This is nerve supply column. And this is lymphatic drainage column. Let's start from the venous drainage. The veins follow the corresponding arteries. First is frontal sinus. It is drained by anterior ethmoidal vein, which drains into superior ophthalmic vein and finally to the cavernous sinus. Next is ethmoidal sinus. Anterior and posterior ethmoidal veins drain to superior ophthalmic vein and then finally drain to the cavernous sinus. Next is maxillary sinus. It is drained by alveolar veins which drain to sphenopalatine veins and then to the pterygoid plexus of veins and finally to the cavernous sinus. Next is sphenoidal sinus. It is drained by posterior ethmoidal vein which drain to sphenopalatine vein and to the pterygoid plexus of veins and finally to the cavernous sinus. Next is nerve supply. Nerve supply of the frontal sinus is supraorbital nerve from ophthalmic, that is V1, first division of the trigeminal nerve. Next is ethmoidal sinus. Nerve supply is anterior and posterior ethmoidal nerves from nasociliary nerve and which is from the ophthalmic nerve, first division of the trigeminal nerve. Next is maxillary sinus, which is supplied by infraorbital nerve, anterior, middle and posterior branches of the superior alveolar nerve from maxillary, V2 nerve. Sphenoidal sinus. Nerve supply is posterior ethmoidal nerve from nasociliary nerve from ophthalmic V1 nerve. Now we talk about the lymphatic drainage. The lymphatics of the paranasal sinuses comes from the capillary network in the mucosal lining and they drain to, in the case of frontal sinus, to submandibular nodes. In the case of ethmoidal sinus, to retropharyngeal nodes and submandibular nodes. From the maxillary sinus, drain to submandibular nodes. Sphenoidal sinus, drain to retropharyngeal nodes. And see further in slide number 29, 30 and 31. This is right anterolateral view of the neck, showing the lymph nodes of the neck, Robin's lever. This is hyoid bone, an imaginary line crossing just below the hyoid bone is called hyoid line. This is thyroid gland. Deep to the thyroid gland is the cricoid cartilage. Another imaginary transverse line at the level of cricoid cartilage is called cricoid line. This is the body of the hyoid bone. This is anterior belly of digastric muscles, right and left. This little triangle above the body of the hyoid bone is the submental triangle. At the tips here, we have submental lymph nodes. This is Robbins level 1A. This is inferior border of the mandible. This is anterior belly of digastric. This is posterior belly of digastric. This area is your digastric triangle, which is divided into two parts. The anterior part, where we have submandibular salivary glands and submandibular lymph nodes, we call Robbins level 1B. Posterior part, if you see here, this is internal jugular veins crossed by posterior belly of the digastric. We have another group of lymph nodes are there called jugulo-digastric nodes, that is Robbins level 2. Below the posterior belly of digastric and anterior to the sternocleidomastoid muscle and behind the strap muscle is our carotid triangle is there, big one, and we have superior belly of omohyoid muscle is dividing this big triangle into two smaller triangles. This is the triangle where we have a carotid vessels and jugular veins is present. This is where we call as Robbins level 3. And below this muscle, this small little triangle where your superior belly of omohyoid is crossing the jugular vein is called jugulo-homohyoid nodes or Robbins level 4. Posterior to the sternocleidomastoid muscles, here is another triangle, posterior triangle of the neck. Behind is our trapezius muscle. This is 11th cranial nerve, also known as accessory nerve. The area above the accessory nerve is the Robbins level 5A, as the lymph nodes is there. Below is Robbins level 5B. This is muscular triangle in front between the strap muscles. This is Robbins level 6. Here is the sternum. Behind the sternum is Robbins level 7. Lymphatic drainage of the paranasal sinuses. Lymphatic of the paranasal sinuses form the capillary network in their lining mucosa, which together with the lymphatics of the nasal cavities drain into the lymph nodes at the following levels. Level 1B, retropharyngeal and submandibular nodes. This is the one. From level 1B drains to level 2, that is also called jugulo-digastric nodes, or also called as superior deep cervical group. So this is the superior deep cervical group. From level 2 drains to level 4, which is inferior deep cervical group, also called jugulo-omohyoid nodes. From there, on the right side through the right lymph duct and on the left side through the thoracic duct, drain into the venous system. Lymphatic drainage of the paranasal sinuses. Robbins level. Lymph capillary network from the paranasal sinuses drain to retropharyngeal and submandibular nodes, level 1B, and from there to the jugulo-digastric nodes, level 2, from there jugulo-omohyoid nodes, level 4, and through the jugular trunk on the right side through the right lymph duct and on the left side through the thoracic duct enter the junction of the internal jugular and subclavian veins into the venous system. Development of the paranasal sinuses. Mucous membrane of the nasal cavity is lined by respiratory mucosa, that is pseudo-stratified ciliated columnar epithelium with mucus-secreting goblet cells. Paranasal sinuses are developed as diverticula of the nasal mucosa of superior, lateral, and anterior mucosal walls. They extend into the surrounding bones and dilate into frontal, ethmoidal, maxillary, and sphenoidal sinuses. They reach the maximum size during puberty. This diagram is the coronal section of the paranasal sinuses on the left side of the nose. These are the color boxes showing the size of the age group. For example, this yellow color means at birth, blue color means 1 year, and etc. like that. So this is frontal sinus, this is maxillary sinus. In frontal sinus, there is no yellow color, means it is not present at birth. But it has blue color, so that means it is formed at 1 year age group. Green color up to here shows that at 7 years it is about this size. In the case of maxillary sinus, you can find yellow color. That means that it is present at birth, maxillary sinus. Say green color means maxillary sinus is about this size at the age of 7 years. This is name of the sinuses, status of each sinus, first radiologic evidence. Maxillary sinus present at birth, formed at about 4th month of intrauterine life. First radiologic evidence is at about 4 to 6 months after birth. Ethmoidal sinus present at birth. First radiologic evidence is at about 1 year after birth. Frontal sinus not present at birth. First radiologic evidence is at about 6 years after birth. And sphenoidal sinus not present at birth. First radiologic evidence is at about 4 years after birth. Sequence of development is from inferior to superior. That means maxillary first, ethmoidal second, frontal third, and finally sphenoid sinus is formed. Functions of the paranasal sinuses. Mucous membrane of the nasal cavity and paranasal sinuses are lined by respiratory epithelium, that is pseudo-stratified columnar ciliated epithelium with mucus-secreting goblet cells. We have already stated this earlier. Paranasal sinuses increase the surface area of the uppermost part of the respiratory tract. However, it is not clear about the functions of the paranasal sinuses. Probably, they are to provide resonance to the voice, to adjust the temperature and humidity of the inspired air closer to the body's need, as defense, trapping the dust and the microorganisms by mucus and sweeping out to the nasal cavity by cilia, to provide local immunological defense, to lighten the skull, and for the growth of skeleton of the face after birth. References. Thank you. For further reading, CT Normal Anatomy of Paranasal Sinuses. DAHAR Free Education, The End. Thank you. Illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Program Advisor Dr. Ramita Wirza OK Ramat. Contents Advisor Dr. Yo Zing Yi. Technical Advisor Dr. An Seng Beng. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you so much.